You're not cooked, but you're cooking. If you just finished surgery, you can't look at the stuff I post on my page and try to just copy it. You're going to get worse. So you need to scale it way back and not train to a strength difficulty, but train to a true tissue tolerance level that you can handle. So maybe just 5 reps or 10 reps and see how you recover the next day. And then over months, scale that up. You have to work at the pace your body allows. You can't just take anybody's word for it. On the internet or in clinics, you need to be your own back expert because you know how it feels every single day. Next question. Once we get to 30 bodyweight reps with full flexion at the bottom, do we focus on weighted reps or on single leg back extension? Is that nuanced? Yeah, so you should have already been working the iso hold single leg before you even got to reps. That's how it's laid out on the website. If you're not yet a member, lowbackability.com, you sign up at your own price. That's where everything's down to a T. I really would recommend it. It's not a high commitment, but it's a high impact. So the goal is the layout of training to the back extension isn't laid out to a science for strength development. It's laid out in a practical order to prevent the most flare-ups and missteps for most people. So most people's intolerance is spinal flexion, is their mechanism rounding of disc injuries. Some people have more intolerance extending back, not flexing, and that's okay too. But to be safe, without any motion, backwards or forwards, extension or flexion, we just start isometrically. Let's hold tension. No motion, just tension. Can you handle your back muscles firing for 1 minute straight without a flare-up, without a spasm? If you can't even do that, then we can't ask any other questions about can I squat, can I deadlift, can I do reps on the back extension. You need to just wake up your back to being okay participating in the party. Hey, I'm here, I can fire, and I'm good. That should be your first few months. And the reason I bring it back to this, I know your question was about reps. It's the single leg, which is next, to show the predisposition to shift. When you go to one leg on the machine, your body wants to semi-tip off of it. And now some of that's your glutes to hold yourself up, but the other part is small little paraspinal muscles that go diagonally. Rotatorus, it's in the name, rotation. It helps prevent your vertebrae from just slipping micro in a rotated position. So some people can do iso holds on the back extension, no problem for 2 minutes. The second they try to do a single leg iso, they feel a whole new pain shoot up. They're like, what is that about? And that shows the discrepancy on those smaller paraspinal muscles to keep them from rotating. So that's why we put a minute hold each leg there before you even start doing reps. So if you're fine with the holds, the single leg holds, and now 30 reps, it's kind of up to you whether you feel you need more rebalancing of a left-sided versus right-sided back approach, because the single leg will keep helping with that, or if you want to just load 2 legs. I would prefer keep training the body weight at harder levels before you add extra weight. So that's kind of your discretion, but if you had no problem with the single leg holds, you may be good just to do weighted 2 legs. If single leg holds was pretty tough on you, I would want to see what that's like with reps too.